So let's begin the Board of Health meeting for December 13th at 5 p.m. Everybody's in attendance. Aria Zayas, Chris Mills, health agents Tim Myers and Mark Taylor and Kristen Kennedy. In keeping with an act relative to extending certain COVID-19 measures adopted during the state of emergency signed into law by Governor Baker on June 16th, this meeting will be conducted remotely over Zoom. Attendance by board members will be remote, and remote attendance shall count towards quorum. The meeting will be broadcast live and recorded on ECAT. To use Zoom, you'll need to use a link on the agenda or download the Zoom application at www.zoom.us and create an account, or use one of the call-in numbers listed on the agenda. While conducting meetings remotely, we will endeavor to keep meeting operations as close to standard procedures as possible. However, use of this platform will necessitate some additional meeting protocols. While the board members or commissioners and applicants will be on video and audio, public participants will join the webinar as attendee, meaning they are muted and with no video feed from them. During the public testimony portion of the meeting, members of the public can be recognized by using the raise hand function found under participants for Zoom, or make a request with the Q&A function. If you're joining only by phone, you can press *9 to raise your hand. Excuse me. Okay, so let's begin the meeting. We'll start by, I'm so sorry, guys, approving the minutes for November 8th.
Make a motion to approve the minutes for November 8th.
Second.
All those in favor?
Zayas, yes.
Mills, yes.
LeBlanc, yes. Next on the list is variance for 6 Day Street. It says in accordance with 310 CMR 15.405 1A, the following upgrade approval is requested to reduce the requirement of a 10-foot setback from the side property line to the soil absorption system to 5 feet.
Okay, I do not see anyone from Jacobs Driscoll Engineering on the participants yet. Maybe we can table this and come back to it. Maybe I did text Greg Driscoll.
Amanda's there.
Is she?
So I'm going to admit, I'm going to promote Amanda.
Okay. I did not see her, sorry.
Hi, I'm here.
Hey, Amanda, could you state your name and address, please?
My address? Yeah, sure. Amanda Langer with Jacobs Driscoll Engineering, 50 Oliver Street.
Okay. Thank you.
Okay, Amanda, would you like to make the presentation of why you need the requirement for the reduction to the offset for the sideline of the septic system to the lot line, I mean?
Sure. So I'm assuming you guys all have the plan. Is that correct?
It should be in the packet for everyone.
I mean, aside from the obvious, it is a extremely tiny lot. The only feasible place we can put the system is in the backyard, where we did do the soil testing. That's where the current existing system is. It's a very old system, and it's definitely failed. Unfortunately, the only place we can put this system is in the backyard. As you see it, there's really nowhere else for it to go.
Any questions from the board? If you look at it on your plan, it is shoehorned in there. And they're going from 10 feet off the lot line to 7.4 feet off the lot line. So they're doing the best they can. I have reviewed the plan, and there's been several revisions. Kristen has been involved on it. If she'd like to say anything towards it, that's
Nope, we're
pass
good.
it on to.
Nope,
Good.
I'm good.
I mean, I don't see how you can't grant a variance. I used to live in the village area, and it's I don't know how they even engineer septics for down there. It's awful. I mean, it's the reason why some sections have sewage now. I'll gladly make a motion to get the variance on that.
Is the variance to 5 feet or 7.5 feet?
So typically, as a rule of thumb, we
Ah.
always set it for more than what we show proposed, just in case something does happen and they end up, installing it 6 feet and they run into an issue out there, just so they have that little extra area of buffer. Because we have had situations, not that we anticipate that happening with this, but we have had situations in the past where, something happens, something arrives, and rather than go back in front of you guys and say, listen, this is what's going on, we request that little extra room for error, as we say,
So the variance would be for that 5 feet, just in case.
for the 5 feet.
Yeah, from
Correct.
10
Even
to
though the
5.
plans say, okay. Any questions?
I'll make a motion to approve the variance, excuse me, for 6 Day Street, to reduce the requirement of a 10-foot setback from the side property line to the soil absorption system to 5 feet.
Second,
All those in favor?
Zayas, yes.
Mills, yes.
LeBlanc, yes. Thank you,
In-
Amanda.
And just a
Thank you,
correction, it's
guys.
the rear property line. That's all.
Yep.
Okay,
Thank you guys very much.
thank you.
Thank you. Next on the list is for discussion, the novel coronavirus update.
So no surprises. As many of you, I'm sure you have realized, the COVID case counts continue to rise. We last week posted a number the state posted our number for the 2 weeks that included November 21st through December 4th as being 161 cases. They will not officially pull the data for the next posting until Wednesday. Today is Monday. But I can run the report in anticipation and get a ballpark figure. So when I earlier today ran the report for 12/28, I'm 11/28 through 12/11. Now that means, and why I say this number will probably change, is there are people that tested on the 11th whose results have not flowed into Maven yet. We're already at 221 cases. That actually reflects 114 confirmed PCR tests that were done last week. So the numbers do continue to rise. We are taking advantage of every tool we have in our toolboxes, and we are promoting and able to stand up pretty quickly some booster clinics. Last Friday, not this just past Friday, a week before, on the 4th, or the 3rd, I'm sorry, Governor Baker asked all of the town managers and town administrators and mayors to begin helping get vaccine boosters in the arms of the residents. Easton responded, and we held our first booster clinic 1 week later. It was kind of a soft opening with 100 doses just to test everything and make sure that all the cobwebs were dusted off. We have another clinic ready to go this coming Wednesday. That will be 200 booster doses. Registration for that is available through the town's website. Another tool that we have in our toolbox is the ability to perform rapid COVID testing, and people can use that to frame their decisions for how they go forward and how they conduct themselves, especially as we go into the weekend. So we saw the value in that last week, and we stood up a Binex Now rapid COVID tested clinic or pop-up walk-in. Again, we registered 100 people. We did have a number of no-shows, but we did end up doing, I believe, 84 tests. We had 10 positives that popped out of that 84. But it's a really good opportunity for people to, we had families come through saying, this is what you have to do, kids, because we want to go see grandma this weekend, or we have a function coming up. We had people come through because they needed negative tests to attend plays and other large venue events. So seeing the value in that, we have scheduled another one of those this week. So this Thursday, we will repeat that from 5 to 7 p.m. Again, the link is on the town website for anybody who would like to register and avail themselves of that. There's no cost. People come through. It's a very quick process. You check in, you go to a station where you're either proctored or assisted by members of the Easton Fire Department, and then you leave. You can go wait in your car, you can drive home, and we call anybody who tests positive. If you don't receive a phone call, you've tested negative. The best use of our time is spending the time with those 12% that the state average that we mirrored that will test positive in one of these types of clinics. We are also this Friday through the state, we requested they call it the VAX bus, but it really isn't a bus, for a clinic that will be strictly for 5 to 11-year-olds at Easton Middle School. The link for that is also up on the town webpage. If there are any parents listening that may have previously registered their children for that clinic, you should have received an email over the weekend from the state's provider asking you to go back in and rebook your accounts. They ended up with a technical problem, and they needed everybody, and still do need anybody who has not done so yet, to go in and register using the new link that's up on our website. The school department, I believe, was sending out an email this afternoon, just making sure that all parents that may need that information have that information. If anyone tried to register in the past couple of days or earlier today and might have hit what seemed like a full message, please go to the website, use the new link that's up, and hopefully we can get you in. When they realized they were having this problem, we had 170 families, 170 children booked, which is fantastic. The clinic will max out at 200, and that clinic's going to run Friday from 4 to 8. Like I said, it'll just be the 5 to 11-year-olds. They're not able to accommodate any older siblings. They're not able to accommodate any boosters at that clinic. We're looking ahead to the following week and are trying to put the finishing touches on another booster opportunity, as well as another testing opportunity for people before they go into the actual holiday weekend. Identifying those asymptomatic positives, or those people whose symptoms are so mild that they may think they just have a cold, or they're just having an allergy reaction to maybe the live Christmas tree that's in the house, or some other thing that may be going on. It's a great opportunity to just get tested and know before you go out and spend time with other people, especially indoors. The state is in a very good position in that we've got 82% of the population has had at least one dose. And we are on track right now. The last numbers that were reported to us by the state were that 34% of the 5 to 11-year-old population had already started their vaccine series. So we're in really good shape compared to a lot of other places in the country. But right now, the testing and the vaccines are our best tools to try to get COVID under control. One of the other things that has changed in the past couple of weeks is that the state has determined that from an epidemiological perspective, we no longer need to fully characterize the transmission of every single case of COVID. And what that means, and I know I had told you guys that CTC was going to be going away. As part of that, the state is now telling us to do the best we can, but that individual cases now are a very low priority for us to be following up with on the phone call basis. We're doing our best. The guys can tell you how many cases were in the workflow this morning when you guys logged in.
5 or 6.
That was it, 5 or 6. Okay, great. So they're able, as long as the numbers are manageable, they are making every effort possible to try to get in touch with people, to offer support. But there has been a shift in that we no longer are collecting close contacts and working directly with them. We're advising our positive cases on how to communicate that to their contacts and providing them tools to then pass along as far as the calendar that we use and when people are eligible for testing. So the state has asked us to direct our efforts to supporting the K-12 schools, supporting the early childhood education centers, and to prioritize clusters of a reoccurring nature. Something like a wedding that resulted in a number of positives is very low on the epidemiological priority list right now because it's not going to perpetuate from there. It isn't going to reoccur. You get in touch with the individuals, they tell their contacts, everybody's on the lookout, and they try to get through as quickly as they can, as opposed to something that is more of a reoccurring nature, like a club or a class that would be meeting, that would continually be spreading the COVID if people were asymptomatic and were unaware of their status. So that's where we're kind of directing our efforts a little bit more. The state is really amping up and asking people to participate in their Mass Notify app that they have. There's right now about 25% of the population that is enrolled in that, and it's basically a self-reporting of positive results that then through the app they're able to notify cell phone numbers that were in proximity to that positive while they were infectious, that it would be in their best interest to get tested, to consider themselves a possible close contact if they're unvaccinated. And even if they are vaccinated, that they would want to just be on the lookout for symptoms and to take those symptoms seriously. But that is about where we are right now with COVID. Are there any questions or concerns from the board?
So that just the Cliff Notes version, do I understand that the contact tracing is not going to be as much as it used to be? Okay. And how about, I guess this doesn't matter to residents or whatever, but maybe to satisfy my own curiosity, is there COVID funding still coming in? Is there any available? Is there stuff like that?
The funding has changed. Initially, we got CARES Act money that was to put these things forward. Now we've moved into the recovery. That money is done. That's closed out. Now we've moved into the ARPA money, the recovery money. That has to be that, we are looking at using a portion of that to stand up and staff these clinics and to possibly stand up and staff if we ended up needing to purchase our own boosters. I mean, not purchase our boosters, purchase our own testing kits. That there is, but it's a different mechanism.
And so whose discretion is it as to where the funding gets directed to? Is it federal, or is it you as a town administrator, or how does that work?
So there are federal guidelines around that money. And then the town administrator has prepared his ARPA plan for the monies. There's, the dollar amount keeps changing. And he has put together his ARPA plan for where these monies will be going. I don't have that available right now. I'm not sure when he was sharing it with the select board. I would have to go back and look at their agenda and see when.
And that money specifically has to be used for.
There's very prescriptive reasons that you can use.
It's not like, I don't know, you can't use it for for lack of better terms, like a COVID bonus or anything like that, like for people working through it or anything like that. It's very specific as far as, testing, whatever.
Certain kinds of staff, things like that.
I don't have the knowledge, that's a question for the town administrator. I don't have the answer to that.
Yeah. That's fine. I just, like I said, it was more to satisfy my curiosity than anything else.
Yeah, because I get a lot of emails myself between working in the school system and being on the board, where it says that certain funding is coming in to assist with COVID concerns in schools and with the Board of Health. So perhaps we will need to look at getting some of that information to the public so they can see kind of where the money has been going. Kind of keep track of it like that a little bit. Thank you, Chris.
Is there a dollar amount that the town gets? Is every town the same? Or I'm assuming cities obviously get more.
I believe that there is, I think we're close to knowing what the number is. I don't
Mhm.
have that number. Again, that would be part of the town administrator's presentation on his ARPA plan.
Okay. All right. So anything else, guys, on that? All right. The next thing on the agenda is the beaver muskrat related activity to consider the issuance of an emergency permit to immediately alleviate a threat to human health and safety from the beaver or muskrat related activity.
So if you recall, we had an emergency meeting. You voted to grant this permit to allow there to be work to be done to dismantle the beaver dam. But because it was an emergency meeting and it was less than the posted time, it had to be voted at an appropriately posted meeting, except when it got posted again, the verbiage was not correct and just said beaver update. It didn't say exactly what you were going to do. So now it's back on there again, and it is, the language on it is correct. And all you need to do is reaffirm that vote that you took previously, that a permit was issued to alleviate the imminent hazard, the threat to human health and safety because of the muskrat and beaver activity.
You're muted, Aria.
Yep. Sorry. I make a motion to approve the issuance of the emergency permit to immediately alleviate a threat to human health and safety from beaver or muskrat related activity.
Second,
All those in favor?
Zayas, yes.
Mills, yes.
LeBlanc, yes. Okay, and then there are no betterment applications. Are there any other things that came in that we need to know about or discuss? Any issues ongoing?
No, it's just busy, very, very busy.
Okay, so if there's nothing else, I'm going to make a motion to adjourn the meeting at 5:23 p.m.
Seconded.
All those in favor?
Zayas, yes.
Mills, yes.
LeBlanc, yes. Thank you, everyone. If I don't talk to you guys, have a great holiday season.
You too.
You too,
Bye-bye,
thank
guys.
you.
Aye.
Happy holidays, everyone.